Welcome to the Doctor's Guild. If you're new here, we bring you clear, practical health tips to help you live a healthier life. In this video, you'll learn about 10 everyday foods backed by science that support heart health and help bring down blood pressure. What is high blood pressure? High blood pressure often shows no symptoms, yet it raises the risk of heart attack, stroke, and kidney disease. The good news? Small changes to what you eat can lower your blood pressure. Today, the Doctor's Guild shows 10 foods backed by science that may help and practical ways to use them every day. We'll explain not only which foods help, but how they work, how much to eat, quick recipes, and important safety notes, especially if you take medicines or have kidney issues. This is educational only. Always check with your clinician about personal medical advice. 1. Leafy greens, spinach, kale, Swiss chard, potassium nitrates. Leafy greens are powerhouses of potassium and dietary nitrate. Potassium helps kidneys remove sodium, and dietary nitrates can increase nitric oxide relaxing blood vessels. Evidence and notes. A heart-healthy, potassium-rich diet is a core recommendation for blood pressure control. Serving and how to eat. 1 to 2 cups raw greens daily. Add to smoothies, salads, omelets, or Wilton stir-fries. Practical tip. Toss raw spinach into a morning smoothie. You won't taste it. Caution: if you have advanced kidney disease or are on potassium-sparing meds, check with your doctor before increasing potassium. 2. Berries. Blueberries, strawberries, raspberries, anthocyanins. Berries contain anthocyanins and polyphenols that support healthy blood vessels and may help reduce the risk of hypertension over time. Evidence. Cohort and intervention data link higher anthocyanin berry intake with lower incident hypertension and improved endothelial function. Serving and how to eat. Aim for 1 cup daily as a snack, on oats or yogurt. Frozen berries are great and affordable. Practical tip: make a berry oat smoothie or top your morning oatmeal. Caution: watch added sugars if using prepared smoothies or sweetened jams. 3. Beets, beetroot juice, dietary nitrates, nitric oxide. Beets are rich in dietary nitrates. Gut bacteria convert these to nitrite, nitric oxide, which relaxes blood vessels and can lower blood pressure. Evidence. Randomized trials and meta-analyses show beetroot juice or nitrate supplementation can lower systolic and diastolic BP in many participants. Typical trial dose 1, 250 500 ml serving of beet juice or standardized nitrate dose. Serving and how to eat. A common trial dose was about 250 ml 8 Oz of concentrated beetroot juice. Eating roasted beets several times a week is also helpful. Start with small amounts to avoid digestive upset. Practical tip: add roasted beets to salads or try 1 part 2 cup cooked beets, plus a squeeze of lemon. Caution: if you're on nitrate medications or take PDE5 inhibitors, e.g. sildenafil, or have low blood pressure, talk with your doctor. Nitrates can potentiate blood pressure effects and interactions are possible in specific drug combinations. Also, beets can temporarily color urine red-pink. Harmless. 4. Bananas. Potassium. Bananas are a convenient potassium source. Potassium helps balance sodium and supports normal blood pressure. Evidence. Potassium-rich diets are associated with lower BP. Common fruit sources like bananas provide 450 mg potassium each. Serving and how to eat. 1 medium banana per day as snack in smoothies or sliced on oats. Caution: people with kidney disease or on certain medicines, ACE inhibitors, ARBs, potassium-sparing diuretics, should talk to their clinician before increasing high potassium foods. 5. Oats, beta-glucan soluble fiber. Oats supply beta-glucan, a soluble fiber shown to modestly reduce systolic and diastolic blood pressure, especially when consumed consistently. Evidence. Systematic reviews show oat beta-glucan intake, roughly 3 to 5 g day, reduces BP modestly after several weeks. Serving and how to eat. 1 to 1 cup cooked oats daily, porridge, overnight oats. Add berries and a sprinkle of nuts. Practical tip: swap refined breakfast cereals for oats for sustained benefit. 6. Garlic, allicin, and vascular effects. Garlic contains bioactive compounds, e.g. allicin, that can help relax blood vessels and lower blood pressure, often more notable in people with hypertension. Evidence. Meta-analyses of randomized controlled trials show garlic supplements can lower blood pressure in hypertensive patients, in some cases to clinically relevant degrees. Serving and how to eat. Use fresh garlic, 1-2 cloves day, in cooking, or standardized aged garlic extract if recommended by a clinician. Caution. Garlic can increase bleeding risk and may interact with anticoagulants, e.g., warfarin. Avoid high supplemental doses without medical advice. 7. Fatty fish and omega-3s. Salmon, mackerel, sardines, EPA, DHA. Omega-3 fatty acids from fatty fish reduce inflammation and often produce small reductions in blood pressure, especially at higher intakes. Evidence. Meta-analyses suggest EPA plus DHA, typically 2-3 g day in trials, can lower systolic BP modestly. Regular fatty fish intake, 2 servings a week, is recommended for heart health. Serving and how to eat. Aim for 2 servings of fatty fish weekly, e.g., 3 to 4 oz cooked salmon or sardines. If you don't eat fish, discuss omega-3 supplements with your clinician. Caution. High-dose supplements can have side effects and interact with some medicines. Prefer dietary fish first. 8. Pomegranate, polyphenols, blood flow effects. Pomegranate, juice or seeds, supplies polyphenols that may improve blood flow and have been associated with reductions in blood pressure in some studies. Evidence. Systematic reviews and trials show pomegranate juice can lower systolic and diastolic BP in certain groups, but results are mixed and higher quality trials are still needed. Serving and how to eat. 1-2 cups seeds daily, or a small glass, 100-200 ml of unsweetened pomegranate juice occasionally. Caution. Pomegranate juice may interact with some medications, similar concerns as grapefruit juice in a few studies. If you're on statins or other drugs metabolized by CYP enzymes, check with your pharmacist, doctor, before regular high intake. 9. Dark chocolate, high cocoa flavanols. Dark chocolate rich in flavanols can improve endothelial function and produce small BP reductions when eaten in modest amounts. Evidence. Meta-analyses show flavanol-rich dark chocolate produces a small but measurable reduction in blood pressure, on the order of a few mmHg. Trials often used 20-30 g-day of high flavanol chocolate. Serving and how to eat. Choose chocolate, 70% cocoa, and limit to 20-30 gr. 1 small square or 2, a few times per week. Avoid high-sugar milk chocolates. Caution. Calorie and sugar content can negate benefits if consumed in excess. 10. Beans and lentils, fiber, magnesium, potassium. Legumes provide fiber, plant protein, magnesium, and potassium, all nutrients linked to lower blood pressure. Evidence. Randomized trials and systematic reviews show greater legume intake helps reduce BP and improves other heart health markers. DASH-style patterns that include legumes perform well for BP control. Serving and how to eat. Aim for 1-1 cup cooked beans or lentils, 3-5 times a week. Add to soups, salads, stews, and tacos. Practical tip. Keep canned low-salt beans or cook large batches of dried beans on the weekend for quick meals. Conclusion. Remember, no single food is a cure the strongest. Lasting effect comes from an overall heart-healthy pattern, like DASH, lots of plants, whole grains, lean proteins, and low sodium. Add these foods regularly, pair them with exercise and weight control, and you'll be doing your heart a favor. If this helped, like the video, share it with someone who needs it, and subscribe to the Doctors Guild for evidence-based health tips. Links to the studies and resources are in the description. This video is educational only and does not replace medical advice. If you have high blood pressure or are on medications, consult your doctor before making changes. If this is your first time here, kindly hit the subscription button and subscribe to our channel for more health tips. Thank you for watching.